The 2012 Fine Awards for Teamwork Excellence in Healthcare. Silver winner: Excela Health, Latrobe, and Westmoreland Hospitals. Reducing observation status wait times.
Patients who were admitted to observation services had extended lengths of stay. The financial impact for the hospital was poor, the patient experience was poor, the efficiency for physicians was poor, and we felt that we needed to act. We assembled a multidisciplinary team: physicians, nurses, frontline workers, unit secretaries, folks from laboratory and hospital administration, and collectively we began to examine the process of observation care.
So knowing that our observation length of stays were more than 36 hours, we had some that were more than 80 hours, believe it or not. We knew we had a problem that we had to address and do it quickly.
Nearly half of the patients who are seen under observation services have chest pain. The criteria for whether you get admitted with chest pain or placed under observation services are strict. So when a patient comes to our emergency room, they're evaluated and a determination is made whether to admit them as a bona fide inpatient or to place them under observation for additional services. One of the key features of our observation journey was the creation of 24/7 case management coverage in our emergency room and observation units. By placing our case managers into the admission process early on, we were able to screen these patients appropriately and make the right determination up front. By having that involvement at time equals 0, we were able to reduce the number of conversions of observation patients to inpatient status by about 40%. One of the fundamental features of our success has been the education and empowerment of our nursing staff. Our observation units are manned by nurses who really understand the importance of observation care. We incorporated a number of techniques. Some of them I learned as part of the Perfecting Patient Care experience at the Pittsburgh Regional Health Initiative and Jewish Healthcare Foundation. Our staff came up with a plan to carefully review the patient's course of care 3 times during this day. We have a huddle that regularly reviews the patient's course, where they are, what they're doing, what needs to be done, can we meet the deadline.
So we're looking at the 18-hour timeout here. I see room 4 is meeting the time. What's the plan with her?
Well, she had her stress test this morning and she just came back about 15 minutes ago. So in 45 minutes, if we don't have the results, I will call the doctor and get those.
Okay. And what about
delivering observation medicine is a challenge. It is different from traditional inpatient care. We started this journey with an observation length of stay of close to 28 hours. We've reduced that length of stay to about 18 hours on average. The nurses and the case managers played a key role, and we listened to them in how we could address their needs in doing their job better and getting it done the right way.